Welcome everyone to this first Scottish Collaboration for Public Health Research and Policy Research Methods seminar series. I don't know how many you know, but the Scottish Collaboration are based in Scotland, in Edinburgh, although most of us are also from overseas as well. And we do a lot of work around public health policy. So this is why I'm doing this talk about evaluability assessments. I just want to, hide my floating controls that keep on coming up here. So in terms of why I thought I'd be good to talk about this is because I've been conducting evaluability assessments now probably over the past 8 years for people such as Scottish Government as part of an evaluability assessment collaborative, and that was working with Public Health Scotland and also with the University of Glasgow. I've also more recently been doing evaluability assessments with local authorities and third sector as part of the public health intervention response studies teams that some of you may be aware of. And I've also supervised master's students to undertake them as well. And I think one of the things I want to get across today is that evaluability assessments can be really big and take a long time, and they also can be much smaller as well and suitable for everybody. So some of these are the range of sort of evaluability assessments that have been undertaken involving the team here at the Scottish Collaboration. And some of the ones at the top, I'm going to be actually talking about the two at the top, the Family Nurse Partnership and free school meals. We've also done a lot of other ones as well. And the one at the bottom, number 7, health issues in the community, that was the one that was done by a master's student a couple of years ago, and they actually went on and got those published as well. So what is an evaluability assessment? Well, basically, it is a pre-evaluation activity that's designed to maximise the chances that any subsequent evaluation of programmes, practices or policies will result in useful information. I'm going to go through that in quite a lot of detail today. So, in essence, you could see it as a decision-making tool about how, well, if to evaluate, that's why it's called an evaluability assessment, because it is something, an intervention evaluable, but also if it is evaluable, then how best to evaluate it. So it provides a clear set of guidelines or recommendations based on the goals of the intervention, what's already known about what's been previously evaluated, importantly, what evaluation questions that stakeholders want asked, and they're not always necessarily what you would expect. And also then what data sources are available for an evaluation. So again, just coming back to what evaluability assessments can offer, they can really help you clarify your intervention goals and the likelihood of a measurable impact. And some of you may have come to some of the sessions we've done about intervention development and 6 Squid. And those of you that have been listening to those will see that there's a very strong relationship between what I'm talking about today and intervention development as well, because they're all part of the same thing, really. It's about when you start off and you clarify your goals and what you want to achieve, you can then really help decide on what you need to assess. So it can also avoid committing evaluation resources of little realistic expectation of benefit. And this is particularly important for maybe, well, all organisations, small and large, in that if you've only got a certain amount of money for evaluation, you want to put it where it's going to be best spent and where you can really hope to answer the questions you want to answer. You can really start to get a constructive engagement with the people that are involved in maybe funding the intervention, policymakers, those implementing the intervention, those delivering the intervention as well. It's really important that you have all those people there as well. And overall, one of the reasons we do it or do them is to make evaluations more useful. So in summary, the value of them, and this is why I really like them, and this is why we use them a lot, is they can inform stakeholders about potential feasibility, scope, approach, and value for money of an evaluation. So there's different methods and approaches, but there are some core elements that seem to go across them. One of them is you really need to get involvement with all the people that are involved, as I say, in the funding, the policy, delivery, implementation from the outset. The next stage is to elaborate, test and refine an agreed theory of change. And as I say, those of you who are involved in intervention development know how important that is. Identification and review of existing data sources. This is incredibly important. And it's one of the stages that I think is often left out before making a decision about evaluation. And then it's about making a set of recommendations, either for or against evaluation. And if it's for evaluation, what is the best type of evaluation to do? And there's always pros and cons with each type of evaluation as well. Now, I said at the beginning about who can undertake evaluability assessment. And, you know, for large scale programs, it's often done by a team external to the program deliverers. And the teams that I've worked with usually have expertise in evaluation methods, program theory, intervention design, outcomes, and also importantly, outcome indicators, and facilitation and working with a range of stakeholders. But I do want to stress that anyone can undertake an evaluability assessment. So you could undertake one as part of a PhD or a master, or if you're a practitioner, or if you're working in a small organization as well. These are meant to be decision tools that everyone can use, really. So now this is some steps that we've used, and they are it looks quite long. What we normally do is we take around 3 months to do them. So these are for some of the bigger ones we do, well, actually some of the smaller ones as well, because there's quite a lot of work needed to be done, and thinking as well needed to be done along the way. So we suggest that it's about 3 months, and you have between 1 and 3 workshops. Now, sometimes you only need 2 if the program theory is highly specified and they've done a lot of work on the intervention beforehand. Sometimes you need more if your stakeholders haven't really thought about what they're trying to do or what the outcome is intended to change. So the steps, and I'm going to go through these in 2 different examples, are you need to start planning the evaluability assessment. You need to do a small literature review to find out what else has been done there. You agree a theory of change, and I'm going to talk about that in a moment. You frame your sort of evaluation questions, and then you identify the data sources that you can use to answer those questions. You then develop and appraise your evaluation options, and then finally you report on your outcomes. So the first one I'm going to talk about, and this is quite a straightforward example. It wasn't the first one we did, but this is the example of family nurse partnerships. Now, the background is that a family nurse partnership was developed in the US, and trials over there showed that it could improve health behaviours in young first-time mothers and also reduce negative outcomes for children. It was implemented in Scotland, but there was an issue about, or a question as to whether could it improve outcomes when we've got a high level of support. Remember that systems differ in different countries. So the healthcare system in the US is quite different from the healthcare system and what we offer over here in Scotland. So we were asked by Scottish Government to undertake an evaluability assessment to determine the best way to evaluate it in Scotland. So they didn't waste time and money going out and just asking people for ideas of how to evaluate it and maybe come up with the wrong sort of evaluation approach. I put the link there to it for you. So the first step is to plan it and undertake a rapid review. So it's really important that you first of all identify your stakeholders that you want to come to your workshops. And I gave you a few examples of those before. One of the ones you might be really useful to have there is, if you can, is people that understand what data is available. So, and that might be the routinely collected data, administrative data, data from surveys, anything, people that understand what data is collected on the outcomes of interest. You develop a timeline for undertaking the evaluability assessment. As I say, for us, it's usually 3 months at the most. And then you undertake a rapid review of the literature or documents to identify your program theory and, importantly, your outcome indicators. And I'll talk a bit more about that as well in a moment. So for us, our key stakeholders for the Family Nurse Partnership were Scottish Government. They were involved in developing the policies, but also they funding the programme and they wanted to fund an evaluation. We had local health boards involved in implementation. We had the FMP national unit. There was actually a unit because it was already, remember, this was already a developed intervention that had been developed and tested in the US. So they had already got their own evaluation team as well. We had education leads who helped educate the FMP practitioners. We had policy leads. We had people delivering the service. And then we had people from National Services Scotland, but they really understood what sort of routinely collected data there was available that we could potentially use for any evaluation in Scotland. Okay, so the next step is to develop and/or agree on your program theory. And the program theory is all about what difference is the policy or intervention likely to make for whom, and what are the key variations we might expect to observe. So what you do here is we did the rapid evidence review, which sort of told us more about what we're likely to expect and what changes in outcomes. And then you also have to do a workshop with your stakeholders. Now, in the case of Family Nurse Partnerships, this program theory was already really well developed. And just so, for those of you that don't know much about program theory, the key elements of it are your inputs. So what resources do you have to help you achieve your aim? The activities, which is usually what we call the intervention itself or the policy. So what actions will you take and what things are you doing? Your outputs, what will help you produce to help you achieve your aim? Often these are things like making sure that people actually take up the offer of the intervention or that it's acceptable. What outcomes, what changes you think will contribute to achieving your aim, and your actual aim, what do you actually hope to achieve? And it's interesting because sometimes you find that interventions or policies are actually developed without really thinking through all these things. And then that makes evaluation quite difficult. The other really important thing, and I'm not going to talk so much about it in this example, but it's really important for the next example that I talk about, is your assumptions. What are your underlying beliefs and what your theory of change is based? So this is our program theory for Family Nurse Partnerships, and some of you may have already seen these before. They're called logic models, theories of change, different things. So for example here, the inputs are your family nurse practitioner workforce, resources, training, implementation, support, and then the activities, which I said before, are like your intervention itself, support and supervision, developing a therapeutic relationship with the mother, and the use of tools and guidance. And then you can come and see, as we go over, you'll see that it sort of goes from left to right, although this is quite simplified. Most of these have sort of things, loops going back on each other, but for we always try and simplify things because it's easier to develop an evaluation plan. So we're looking at things like your outputs, as I say, program engagement, completion of the actual intervention itself, and then your outcomes. These are often either short or long-term outcomes, but some of these is, so the whole point of the Family Nurse Partnership is that you improve self-efficacy, and through improving self-efficacy, you get all these other benefits. So then everything seems to have to go through, mainly through improving self-efficacy. So that's essential to this program theory. So if you don't have improved self-efficacy, it's unlikely you're going to get any of the other outcomes. And then this is like your hypothesized theory of change, and it does work in you know, then you try and evidence this. So They then say you get improved self-efficacy, you get better outcomes for mothers, education, employment, you get better outcomes for children, improved child development, less neglect, you get improved pregnancy and birth outcomes. And then there is also this other theory that you might have impact on, actually through teaching about this or through using this, you might have impacts on health visiting and early years practice, which may have an impact on other services, because you've always got to think that you're putting something like the Family Nurse Partnership into a sort of system that's already delivering things like health visiting. So what's going to be the sort of additional effect of having something like the Family Nurse Partnership? Will it increase the impact on other services? Will it decrease the impact? Sometimes there's unintended consequences of what's going to happen here. So one of the other things, and this is really important in assessing evaluability, so is it something that's evaluability, is that you have to look at things like, is the program being delivered as intended? Have all the assumptions and external influences being identified? Does further work need to be undertaken before it's ready to evaluate? In the case of the Family Nurse Partnership, it was quite a well-established, it had been used in the US for a long time, so no further work was deemed necessary in looking at things like delivery or whatever. It will be different in the next example I give you. So the next step you have to do is like frame your questions and identify your data sources. So we were asked to do this evaluability assessment, as I said, for the Scottish Government. So we need to be understanding, not from a research perspective, but from their perspective, what questions did they want answering? What did they need to know about this service that they were delivering? So we also need to prioritize which outcomes they're interested in as well, because often there's loads of outcomes from a logic model or whatever. There's loads of potential ways it could impact on outcomes for, in this case, women and their children. You need to include usually questions about the process. So is it delivered as intended? Its impact, is it making a difference to young mothers and children in Scotland? And economic evaluations, how much does it cost? Is it value for money? And as I said before, it's really important to have people in the workshop who understand what different data sources there are to help you answer some of these questions. So what we normally do, and this is normally our second workshop, we have a workshop to really sort of agree on the questions that they want answered, and then a bit of a discussion about data sources, and then we go away and we do a lot of work around what data sources are available to answer the questions. So in this case, they wanted some process and economic, which I'm not going to talk about today, but in terms of, they wanted an impact evaluation, and some of the questions they were interested in were, have outcomes for young first-time mothers and children improved by comparison to just receiving usual care? Is there variation in outcomes between or within cohorts? Does it have an effect on inequalities, which is always really important to understand? And has it influenced other services for young mothers and their children? So has it positively, do we get more referrals going to services, or what happens to other services? Now, they had a lot of outcomes, so they ended up prioritising them into some process such as reach and engagement, short, medium and long term. Now, what we then had to do was, right, some of these, like, I'm just thinking, pregnancy outcomes, well, what does that mean? So what we always have to think about is what we call outcome indicators. So this is where we have to identify sources of data, and this is where you really need to understand what's out there first of all, and also if nothing's out there, what you need to collect. So interestingly, in this case, the Family Nurse Partnership National Unit collected data on a lot of the outcomes they're interested in. But we were also interested in the Scottish context. So other sources of data that we identified were things like the Scottish Morbidity Record and the Growing Up in Scotland Birth Cohort Study. And what we felt was overall the data for evaluation was quite good in this case. So then what we did was we looked at the examples of data sources to assess the outcomes. And this is where I'm saying that your outcome indicators are different from your outcomes. Your outcome just relates really to an overall aim or objective, but then you have to have things that, what indicates that you've achieved that outcome. So for reach and engagement, you have to really specify what you're meaning. So in this case, it was the percentage of eligible population reached, completion rates, attrition rates. Improved self-efficacy. Well, how do you measure self-efficacy? It's you could say it's a construct, and they decided that they would measure it through health behaviours, future pregnancies, and relationship with fathers. But again, when you think about what does it mean, how are you going to measure health behaviours? So then you think about, well, what health behaviours are you interested in? So then it might be you have to, then your outcome indicator might be percentage of people who stop smoking, percentage of people who don't engage with alcohol, those sort of things. And then again, for mother-child attachment, that was their outcome, but then the outcome indicators are child responsiveness, home learning, parenting practices. These are what they all decided were the ones that they were interested in. What you can see is in each column, FMP in this instance collected a lot of this data. So this is great for in terms of doing an evaluation, because they already collect a lot of the data you need. ISD could collect some data, and growing up in Scotland potentially could collect some data. What you do see is when they're looking at impacts on other services, there's no outcome indicator and there's no one collecting that data. So just bear that in mind, because if no one collects it, then any evaluation you do is going to have to collect it themselves. That's called like primary data collection. So here we have an example of where you've got data already being collected and where no data is collected at all. Now also bear in mind that even though this data is collected, it's not collected for the purpose, apart from the FMP, the ISD and the Growing Up in Scotland data is not collected for the purpose of your evaluation. So often what you find is that you think it might work and you think you might be able to use it, but actually you can't use it, or it's not that great because maybe the Growing Up in Scotland, for example, they only have a certain number of children, or the children aren't in the areas where FMP is, or whatever. So you really have to be able to understand that data really, really well. So what we then do is, in the middle of this, we go away and we look at all the different sorts of data, and we then look at the questions they've asked, and then we develop a set of evaluation options for them. And these are all just recommendations. They're just like, what are the potential options we think you can do? And in this case, we came up with 4 options. The first one was to continue as they were, which was just with the FMP evaluation that was happening anyhow, with an enhanced analytical plan to identify predictors of variations in outcomes. So what was it about, say, young women or their children that would predict positive or negative outcomes? Our second option was for as the first, plus a cluster randomized controlled trial of FMP versus standard home visiting. Our third option was as one plus a natural experiment, and our fourth option was a realist evaluation in terms of what works for whom, in what circumstances, and why. Now, for each of these, we gave the pros and cons of each option, but I haven't got, you can read it. I'm just going to give you the one that we recommended and the pros and cons of that. So what we recommended for them was that they did their own evaluation plus a natural experiment study, because, as I said before, there was quite a lot of data out there that we could use, and quite a lot of data, routine data collected in Scotland on mothers and children, for example, health visiting records that we could use. But with any evaluation, with any study, as you know, there's pros and cons. So we always give them the pros and cons so they can make a decision about which to go for. So here are a list of the pros and cons, and I'm not going to go through them in a lot of details, but, you know, we said things like it was relatively cheap. And in terms of relatively cheap, we say, I think, because it's cheaper than if you were going to do a cluster randomized trial, it's hugely expensive and you would spend a lot of time collecting primary information. Whenever you try and collect information, sort of surveys or interviews, whatever, it's incredibly expensive. The cons, and I've mentioned this briefly, was the choice of outcome measures constrained by the routinely available data. The routinely available data is just data available for you, maybe on number of births or people smoking, but it's not there to answer your research questions necessarily. So there's always a trade-off between what you can use and what you can do with that data. The analysis was more complicated. Now, when we did this in 2014, I think, natural experiments was still not very well thought of. People still wanted to do randomized controlled trials all the time. That's not the case now. And then the last one, sorry, I'm just trying to hide my, was you may need individual data linkage. For example, if you're wanting to look at, say, mother's employment or whatever, and then child outcomes or something, you might need that data linked, which has its own ethical and time constraints and financial constraints as well. So that was the recommendation we gave to government. What happened next? The Scottish Government commissioned a natural experiment as per the recommendations, and that's just been published as well. I've given that there. Now, that was quite a nice, straightforward, easy one for us. So I'm now going to talk about one that was a bit more complex, and even though everyone thinks that free school meals is a great idea, I'm going to talk a little bit about some of the difficulties in evaluating this. Now, this was actually the first ever big one that we did, again, for Scottish Government. And just a bit of background, we did this in 2014, I think. So up until January 2015, school meals were only provided free of charge to certain children whose family were in receipt of certain benefits. So this is what in public health we call a targeted approach. So it wasn't everybody. And then they did a trial, and then they introduced free school meals for children in P1 to P3, which for those of you not in Scotland, that's 5 to 7 years, in January 2015. So for those children, this is what we call a universal approach. So all children in P1 to P3 had a free school meal or were entitled to free school meals. And the targeted system of free school meals remained for children P4 and above. So again, our plan was to undertake a rapid review. Some of the stakeholders we had at the workshop, we had less range that time, but we had Education Scotland, we had the Her Majesty's Inspectorate, who are responsible for schools and the implementation, and then we had the Scottish Government, again, who had devised the policy and also wanted to fund the evaluation. Now, again, we need to do programme theory. Now, what was interesting about this is they'd never developed a theory of change, so they'd never really thought through what and how they expected to see any change in outcomes. So what we had to do was, we had to actually help them develop a theory of change. So we did a rapid evidence review and also talking to some of the policymakers, looking at policy documents as well. You can sort of get a sense for what they want to achieve. And we identified the following potential outcomes that they felt was the benefits of free small meal. So you increase school meal uptake as a whole, so more children eat a free school meal. You have cash savings for families not already in receipt of free school meals, increased demand for food from local and sustainable sources, healthier diets, improved school behaviours, and improved educational attainment. So from this, we then had a workshop with stakeholders to try and help them develop a theory of change. So this was their theory of change that they developed. So you've got your inputs, like you need your catering staff, you need your teachers to supervise during the extra time. You need actually places to eat as well, which I'm going to come on to in a minute. And your activity is your provision of school meals for P1 to P3. And then, as you say, their sort of pathway to change, as you might think about, is that, for example, you get increased consumption of free school meals, children have healthier diets. One of the things they weren't that interested in, and wasn't the main purpose of it, was then children have healthier weight. What they were really interested in was that children have healthier diets, they get better school attendance, better behaviour, and then that leads to better school attainment. And then also, as I said before, the increased consumption of free school meals meant cost savings for families. Now, as I said last time, and this wasn't a problem with the Family Nurse Partnership because it had been well thought through and theorised and tested from the beginning, but what we need to really think about is it being delivered as it was intended? Have all the assumptions and external influences been identified? And does further work need to be undertaken before it's ready to be evaluated? Now, this is really interesting for me because we identified so many underlying assumptions, and here are just some of them. So, first assumption, for example, school meals are healthier than packed lunches. Children will eat the food that's provided to them. Children make healthy choices. School provide a good lunchtime environment. And I think for me as well, it's this thinking about no compensatory unhealthy eating later in the day. So if one of your aims is to get child healthier weight, for example, and you're thinking, I'm going to give the child a meal during the day, is that meaning that maybe parents or whatever thinking, oh, I don't need to then give my child a healthy meal at night? So then you just have compensation at the outside school. So there's a whole load of assumptions if you're wanting to get, for example, the children having overall healthier diets and then a healthier weight, that you can't just think about the school meal in exclusion from everything else that a child eats in a day and in holidays and at weekends. There's then a load of external factors which we felt might affect implementation. And, you know, there was things like the school's approach to school meals and nutrition education might vary between different schools, and we have different school policies, parental engagement, whether they actually wanted their children to do that and in school meals, food availability and cost, levels of early year provision, whether, you know, when they first did the pilot and then did the implementation, there were some schools that had not had school meals for so long that they no longer had kitchens. And some of them, you know, when you suddenly say all P1 to P3 are having a school meal, well, what happens if you don't have a dining room that's big enough to do that? And what then happens to your whole school day when you've got to get suddenly a whole load more children in, and then you've got P4s to P7s as well who also need to be fed. You've got things about siblings in P3 maybe versus those in P4. Some of them are having free meals, some are having not. And then the other thing that we wanted them to really think about was some of the unintended consequences. And what we didn't know at that point was whether it would affect claims for other benefits due to the link with subsidising free school meals, whether overall school meal food quality suffers. If you haven't got the catering staff, if you haven't got the budget, if you haven't got the resources, maybe school meals, if you're trying to feed all your school as well, all the other P4 to 7, the overall school meal food could suffer. Now, this is interesting as well. I've always wondered about this, about could it increase inequalities? So these, remember, P3 to P1 to P3 were already having free school meals if they met the criteria. So were you going to get greater benefits for the better off families? What happened to the current P4 to P7 having other meals? Would food waste increase? On the plus side, could parental time be freed up if they maybe weren't having to prepare a meal for their children in the evening? So you always have to think these things through, and we felt that a lot of these things hadn't been thought through in this particular policy. So again, we had to frame our questions, identify data sources. We did a workshop and follow-up, same as before. So some of the key evaluation questions they wanted answering was, does school meal uptake increase? So do you get more children actually, if you have this policy, because policies don't necessarily lead to the outcome you intended. So does it actually increase school meal uptake for this group? What's the benefits, the most and least in terms of household finances and diet? So what is the sort of knock-on consequences to the families themselves? Are school meals healthier than what children had before? What are the impacts of having school meals on P1 to P3 children's diets overall? They were really interested because this is their big thing. They wanted to make it so it increased attainment. So what are the impacts of introducing it on school life and classroom behaviour? The idea is that if you give children a healthy meal, so that it's maybe either that they're not hungry when they come to lessons, or that they've got a more balanced and maybe not so much full of sugars and processed food, that their behaviour will change. So this is the underlying hypothesis. And do those who stand to benefit most have better educational outcomes? So do those ones that are now getting it that didn't before then end up having better educational outcomes? So then we went to look at all these data sources, and it was really difficult to find any source of data. You know, it would have been very, very difficult. We didn't at that point have, and this is why we have in future, this is some of our learning, that we didn't really know what data was out there because it hadn't been thought through to enough an identifying source of data. Healthier diets, you could actually, each school publishes a list of what the food is that they give each day. So you could potentially look at what they've been provided, but you still can't determine what they've eaten. They may not like any of the stuff you get and just eat the chips. Interesting, they're looking at school attainment, but in P1s to P3, they don't actually measure attainment. So if you wanted to measure attainment, then you would actually have to do some primary data collection and actually try and measure attainment in all those schools. And you know, you can start to see how costly that would be. What would have been great was if they measured attainment in some way in P1 to 3, then you could have started to look at those outcomes. But they measure it, I think, as far as I remember, before they reach school and then later on. This may have changed. This was in 2014. So we give them 3 evaluation options again. They could rely on existing data, but that wasn't going to help them very much. We wanted them to gather additional data. We wanted to work with the school's inspectorate to enhance the data gathering because they weren't gathering enough data at the moment in maybe a sample of schools. Maybe look again at the Growing Up in Scotland survey, which is a big survey we have in Scotland on uptake of free school meals and the effects on older siblings and meals eaten at home, and then collect qualitative data to explore families' responses. So what is happening in real life, rather than this hypothesized version of what might happen. And then also you would do enhanced routine data, but you then collect a new survey of families to explore the pupil and family level outcomes as well, which would be very expensive. So what we basically recommended to them was to actually work with the schools, just to select a sample of schools to work out how best to evaluate them. So work with them to, you know, think about what data you needed, what data needed to be collected at the schools, but just in a sample rather than going out and doing it in all of the schools all at once. So it's nothing like we could do for the Family Nurse Partnership. And then collecting qualitative data, as I said. So we felt that the pros of that was it was a more efficient and probably less resource intensive way of widening the range of impacts that could be measured. But also we felt it was difficult to obtain a representative sample of schools. You can imagine all the different types of schools that are all over Scotland, urban, rural, big, small, different populations that attend. And so it may not be feasible to do much there. And also the range of educational, dietary and financial outcomes that could be measured could be still quite limited. So what happened next? The Scottish Government commissioned a process evaluation, which is sort of what we recommended, because they felt that this sort of impact, looking at outcomes, looking to see how effective it was, wasn't feasible at that time because, and this is where I was talking about, was it evaluable? Well, it wasn't evaluable in terms of looking at outcomes. It was evaluable in terms of looking at, was it delivered as intended? What was going on? What were potential effects? So some of the objectives, and this is, again, this has been published now, was to look at the key variations in implementation and those that might impact on your outcomes. Identify factors that might contribute to differences in uptake across the schools, identify barriers to implementation. So you see, we're having to go back to, not to basics, but we're really having to go back to in the logic model, you're looking at the things like the activities. So are the activities being delivered as intended? If you don't have that delivery of activities, you'll never get onto any of the outcomes that you hope to achieve. And so it was, you know, really it was to identify learning to further improve implementation of uptake. And then after that, it would be possible to do some more evaluation. This is just a brief thing in terms of what happened in other evaluability assessments. This isn't all of them, but for the ones we did for Scottish Government as part of the Evaluability Assessment Collaborative, they actually took up all our recommendations and all of those were commissioned. So they did commission, you know, what we recommended. They also asked us to do an evaluability assessment of a strategy, the pregnancy in parents and young strategy. We found that almost impossible, because activities in a strategy are very, very difficult to define and the whole sort of process was difficult. So they didn't actually go ahead with any evaluation as far as I'm aware. So in terms of what lessons have we learned, that we think that overall decision makers really like them. It makes them understand their own programs better. It makes them understand or helps them understand the constraints on evaluation design and what an evaluation can and can't deliver, some of the pros and cons. And it makes or helps them look at existing outcome data that can enhance your evaluation options. So basically, the more data's out there, the better your evaluation options are. I think researchers, we really benefited from, and I've really benefited over the last few years from being involved in such different types of one, that getting that shared understanding of program theory and the constraints on evaluation design for us as well has been really useful, understanding in the real world. And often researchers try and do randomized controlled trials or whatever when they're not doing it in the real world, whereas this is evaluation we're doing with data that's out there, or using the, you know, taking advantage of the data or the constraints, and also understanding really what evaluation questions that stakeholders want and need to inform service delivery and sustained funding. And I think they're always useful. I really like them, but I think they're probably most useful, and as you see in the first one for FMP, when the intervention well defined. And I think you also have to have resources earmarked for evaluation, but you really don't know whether and how best to evaluate. And I think this process can really help you just go through the steps and come out with some options at the other end, and the pros and cons with each, but it's much more sort of a logical, and I like being logical, so it's a much more sort of logical approach, I think, rather than thinking, oh yeah, we just need to do a qualitative, oh we just need to do a survey, we just need to do this, that and the other. So it's about really going through a process.